My name is Michael Polacek. This month's cafe will feature presenter Dr. Dan Morhaim. He's a physician, he's a state legislator for 24 years, academic author and consultant. And this presentation that he's going to give us will help nurses understand the ins and outs of politics, policymaking, and emphasizing how to get your voice heard. Dan brings an informative and entertaining speaking style, personal stories. Afterwards, we'll have Q&A. So Dan, go ahead, take it away.
Okay, well, thank you. Thank you for coming. Thank you for being nurses. I have been to Kenya and Tanzania. A lot of what I'm going to say is about the United States, but some of the principles will apply. So thank you, Rahima and Ronnie, for the work that you're doing there. I saw some medical things when I was in your countries, which I found to be really incredible and beautiful. So, and I've been to all the other states that have been mentioned. So I'm going to move to share screen. And so I'll go over the slides, and let me just go to the full screen. There we go. Everybody can see that? Good. So this is going to be my insider perspective. I feel like the Wizard of Oz when they pull the curtain and then show all the, all the stuff how it actually happens. That's what I'm going to try to do. And there's, like any other culture, politics has its own culture, and with a little bit of effort, you can be really effective. And nurses have great credibility. Like most things, 98% of success is showing up. So for me, I was a practicing ER doctor. I did shifts for day shifts, night shifts, weekends, and holidays, like everybody else, at a big community hospital for 13 years as department chair in the Baltimore area. Then I got elected to the state legislature. I'll get into how I got started. And then I moved over to a level 2 trauma, big ER trauma center in the middle of Baltimore City. I also worked on Navajo Indian Reservation overseas, volunteered physician, homeless clinic in downtown Baltimore for a few years, once a week, things like that. So ER doctor, it's just a stethoscope. You don't have an office and overhead patients and all that stuff, but it's very much keeps you on the front line of what's going on in the community. And that's how I got started in politics. I wasn't one of those people who said, I'm going to be a politician, I'm going to be an elected guy. I just was seeing stuff in the emergency room, 2 in the morning and all day, and probably in your practices too, and that's social antecedents. And if I'm going to deal with all these issues, in the ER, why don't I start taking that information and experience and try to turn it into something practical in politics? Actually, partly what happened was we didn't have recycling. Somebody's on. I hear some movement around. If you could mute everybody, that would be helpful.
Ronnie, your computer is on. Could you please mute yourself so we can hear the presentation? Ronnie, there you go. Thank you.
So we didn't have recycling. I was born and raised in California, but married a Baltimore woman, Maryland woman, and ended up there. We have 3 adult children and now 3 grandchildren. But way back, I was hauling garbage down to the trash can with all this recycling in it. We didn't have recycling in my jurisdiction, Baltimore County. So I started going to my local Democratic club and raised my hand when my then councilman spoke. And I said, why don't we have recycling, blah, blah, blah. It's a good thing. It's happened a few times. One day he calls me up and says, okay, smart ass, I'm going to point you to the recycling commission. And that's how I got started. I got to know some politicos, helped some get elected. I'd been a department chair for 13 years, which was enough for me. And they redrew the district lines, and I threw myself into a campaign. Now, Maryland, Baltimore, it's a very insular community. I'm not from there, so I was kind of the outsider candidate when I ran the first time. But politics also can be lucky breaks, and I had several breaks. One, the show ER with George Clooney was a huge hit in 1994 when I ran the first time. And I knocked on people's doors. I said, hi, I'm an ER doctor. Like, just think of me as George Clooney making a house call for your vote. That was my opening line. Actually, I'd been a mailman for 2 years. I didn't decide to go to medical school till the end of college, and so I actually was a postal carrier in San Francisco. So I was pretty good at walking up and down streets carrying a tote bag, and that was a lot of door-to-door too. And then, and by door-to-door, I did 9 months of door-to-door. We'll get into that a little bit. 4 to 5 nights a week, 4 to 5 hours a night by myself, just to define it. And I had one other lucky break. Dr. Dan alliterative name helped get elected. That's sometimes how things happen. So I got involved in a lot of issues along the way. I ran for office. I was the outside candidate and I won and then got reelected 6 times. So that was pretty good. Then my wife and I decided enough was enough. I want to focus on state issues, local issues. Now in the United States, and for those in Kenya and Tanzania, this may not be as applicable, but state elections are really where the action is. We're all focused on that little town that lives between Virginia and Maryland called the District of Columbia, and DC, which is, all kinds of stuff. But state, all kinds of craziness going on there that we have little control over. But state legislators really affect most of what goes on in healthcare and in your life. And so whether you're interested in healthcare or everybody is diverse, you may have other interests, but look at this list of things that states decide. Elections, all the voting rights issues that are going on and being debated around the country. Civil rights, all the reproductive rights, transgender issues, wherever you're on the spectrum, abortion, all that. All, public school education, whether it's controlled by your state or by your local government. Crime laws. In some states, cannabis is legal. In other states, it's only legal medically. In other states, it's completely illegal. So, crime laws. All healthcare regulation, scope of practice, what nurses can and can't do, staffing requirements, and so on. Insurance, environmental protection, maternal and child care, arts and culture funding, important stuff that makes for quality of life, public transportation, roads, senior living centers, what are we doing with the senior population, and on and on and on. Libraries and books, increasingly more controversial as some folks want to get rid of books in libraries, and other people want to keep them around. And everything else the federal government does not do, which is a lot. And so I want to focus on states, and people overlook that. Now, I'm going to ask a show of hands here, if you can, or just who here knows their state legislatures, state legislators? Raise your hand. If you don't, there we go. Thank you. A couple of you do. But if you don't, that's the people who are making these decisions. And they're also the farm team for federal legislators. In Maryland, most of our, I think with one exception, all of our Congress people and US senators were in the state legislature and local government before that. So, to run for office, if you get elected, sometimes you can do it because you're famous, you're a great athlete or actor, or have millions and millions of dollars. Those are the exceptions, actually. Most of us started out as just average citizens. Barbara Mikulski was the United States Senator from Maryland, the longest serving woman in the United States Senate. She was a short Polish woman, but real feisty. They were going to put a freeway through her neighborhood. She got involved, got elected to the city council, got elected to Congress, got elected to the United States Senate, and was actually popular across all party lines. So most people get started that way. And so when you get involved locally, you may be, just be working with your city council person, and later they become a governor. Let's just take one look at governor things that are happening. This is one that just appalled me the other day. It's January 10th, just a few days ago. Governors have clout too, and they're refusing to, in these 15 states, give food assistance to hungry children. I mean, this is an appalling public policy that's going on. And so, it's, and in the last sentence, 7 have not fully extended Medicaid eligibility low-income individuals. I actually do some consulting, clinical consulting and chart reviews for an ER group in Texas, and the people I work with are pretty conservative politically. I'm a middle-of-the-road Democrat, just to put it out there. And they're unhappy that their governor hasn't expanded Medicaid because a lot of their rural hospitals spread out. These rural hospitals are just not getting service. I said to them, look, you elect these people. They're not doing the policies you like, write them letters and or get them unelected, that's how it works. So I'm going to try and tell you how this all works. And the first thing you have to know is how elections work. People say, oh, elections, it's dirty, it's campaigning, it's politics, it's this and that. Yeah, it's also how it works. And if you don't understand the importance of elections and to participate fully, you're going to miss the point. So each state's legislature is different. And only a few states, California, New York, Pennsylvania, I think Massachusetts, have full-time legislators. Most of the rest are part-time. That is, they're citizen legislatures, which is a good thing. People hold down regular jobs. They mainly meet in the winter months. That's left over from colonial America days where only white landowning males could serve in legislatures. So they were farmers typically. And in the wintertime, the fields were fallow. Spring, they're planting. Summer, they're hoeing. Fall, they're harvesting. So most of them meet in the winter. In Maryland's case, we meet for 90 days, January through April, in our beautiful capital city of Annapolis. But look at these distinctions in states. So you have to know your own state. California, 40 million people. A state Senate district represents about 1 million people. That's more than, I think, the population of Montana, right? So they have state senators here that represent more people than US senators. New Hampshire, little state, they have 400 members in their lower house. That means each one of those state representatives are representing about 3,000 people. Can you see the full slide, or can I minimize that down? Maybe I had to minimize it on mine. Yeah, there we go. Maryland's structured a little differently, 47 senators, 141 delegates, but we're structured differently. We have the same, in most states, the lower house, called representatives or assembly, have smaller districts are run more frequently. Maryland is unique. We have 3 at-large delegates per district. Therefore, we represent the same people as a Senate district over the same 4-year term. Nebraska is one exception that has, it's a unicameral legislature. So each state is different, and you have to know your own state. And the idea that people hold down regular jobs is great. I mean, in the Maryland legislature, we had a couple of nurses and generally 1, maybe 2 doctors at a time of 188 of us. But there was a woman who taught ice skating. There was a physicist, social workers, a guy who owned a couple of dry cleaning places, an accountant, of course, a lot of lawyers. But that diversity of job really made a difference. So when there were issues having to do with, real estate, my knowledge of real estate consists of owning, a house and buying one a couple times, but that's it. But so if there's a bill that says, let's change the real estate some transfer tax from 0.01% to 0.012%, I could go to one of my colleagues and say, what does this actually mean? Is this going to help my constituents? Is it make it better for sellers or buyers, or is it fixing some other problem? So citizen legislature is really a good thing, and it brings you back to real life. They say the worst thing that happened in the District of Columbia in federal Congress was the invention of air conditioning, because they used to not meet in the summer. And federal legislators would go back to their home states in the summer and, mingle with people and be regular. But once it became full-time, it is sort of, enhances your ego and is destructive to your connection with folks. This should advance somehow. This way. So let's look at election numbers. So I'm going to use my district, but this could apply to yours. A typical, how big is your state legislative district? So Maryland is about 6 million people. Let me jump down to my district. Each district has about 130,000 people. About 80,000 are potentially registered voters. Maybe 100,000 are over the age of 18, but not everybody registers to vote. And then districts, the way district lines are drawn, they tend to reinforce the party. The party in power draws the district lines to suit themselves, be the Republican or Democrat. That's kind of common to both. So most districts, the winner of the primary election is going to be the general election winner. Not always. California now has a different system of ranked choice voting. There's some other changes, but most states are that. So you have to look at the primary election. So that's why most districts, so in Maryland, I'll use, if you're in Baltimore City, it's a solid Democrat. You in the Democratic primary, you can take a round the world trip and go with your friend from Western Maryland, which is very conservative and rural. Appalachia kind of goes up to West Virginia, and you'll be fine. You'll win only about 10 districts in my state have competitive general elections. Mine was one of them, by the way. So the the thing is to look at the primary election. So let's start a district of 130,000 people. 100,000 are potential registered voters, but a lot of them aren't registered. So we'll say 60 or 70,000 are actually registered. And then we might break it down to 30,000 Dems and 20,000 Republicans and 10,000 miscellaneous or quote independents, non-affiliated party. Depends how it's structured in your state. Then what is turnout in primary election? Anybody want to take a stab at that? Maybe 20%, maybe less. And further, people will know, gee, I know the name at the top, the candidates for president or senate or governor, and then you go down, called down ballot, where there's all those other offices, you know, clerk of the court and judge and stuff, and state legislators and city council, and most of us don't know most of those people. Then there are all those, and depending on your state, those bond bills and things, which I can't keep up with. By the way, my personal voting habit is I always try to get the way it works in Maryland. I can get the ballot at home, and then I can study all that because I don't even know all the people for judge and stuff. So what do we do in those cases? Most of those down ballot things, we look at the names and we say, well, that sounds like Irish name. I'm Irish. Oh, it sounds like a woman's name. I want a woman. It sounds like a black name. I want a black person. Whatever it is, we make those decisions on that. But they may not agree with our politics at all, but we do that, or we don't vote. So it down ballot dribbles down. And so there's this subgroup of prime voters, people who vote in every prime election, and that brings it down to 5,000 people. From it starts 130,000, there's about 5 or 10,000 prime voters. Those are the people that candidates target in elections. That's who gets the direct mail. That's who, when I did door to door, I don't knock on every door. I had a list of people who vote. I could look up whether Michael voted in the last 3 primary elections. If he did, I'm knocking on, and in my party, because I got to win the primary, I'm knocking on his door. So when I went door to door, you know, I have a list: 101 Maple Drive, 107 Maple Drive, 113 Maple Drive, 129 Maple Drive. Then I cross the other side of the street and come down. That's because you can't knock on every door. So what does it take to win a primary election? 5,000 votes or less in Maryland. That's, we start, boils down to 5,000. So when, you know, look again at New Hampshire, 400 representatives, each representing 3,000 people, you know, 1 vote counts. There was an election in Virginia, maybe a Virginia person remembers, a few years ago, where their House of Delegates had a race that was tied, and it was settled by a toss of a coin. So votes really matter. And when you get into office, the first thing staff does, we may not admit to this, but we just see who are the registered voters in my party, in my district, for every communication that comes in. Now, I listen to everybody that, you know, call my office, whether they're in my district or not. But if there was somebody, you know, we tagged the prime voters. This, you know, I don't know how people voted on secret ballot, but I could find out if Michael was in my district or Leah was in my district. If they showed up every primary election and they call my office, I call them back personally. We make sure they're taken care of because, you know, that's it. It also tells you that when there's an event or something, to show up, and there's, you know, might be 15 people. Gee, if I don't make an ass of myself and they like me, 15 people, talk to a couple others, that's 30 or 40 people. That's a, you know, significant percentage of the 5,000 votes I need to win. General elections go on. So when you're communicating with legislators, state legislators, or if you ever want to run for office, you know, first thing you start off with is, I vote in every election. I vote in the primary election, and we're of the same party if you are. I also talk to my 10 friends and neighbors and, you know, all these other groups. That's how you leverage that influence. So let me assure you, every state legislator knows who the voters are in their district. So a little participation goes a long way. You know, we read about campaigns that have to raise millions and millions of dollars. And if, you know, unless you're, you know, super wealthy, most of us have to raise money. To run an election in Maryland, it cost me about $100,000 a campaign. Certainly it got a little easier to raise money after I got elected the first time. But that means you have to have 1,000 people give you $100, 100 people to give you $1,000, and I didn't have $100,000 of my own money to commit. So I had to, you know, ask everybody I knew for money, which is the hardest thing to do. When I ran the first time, you know, at work at the hospital, I'd, you know, take, it'd be lunch break or something, maybe take a break. I go down to the cafeteria And all the people would see me coming and they knew I was going to ask them for money. So they'd all got up and leave, very quickly. I'd sit down and say, hi, I am running. And they go, thank you. I got to go. Oops, my beeper's going. After I got elected, I'd sit down by myself and they'd all come over and tell me all their, political perspectives. That's how it works. We understand it. It's okay. But a little participation goes a long way. People gave me $5. I was grateful because I knew that $5 for them maybe represented $50 or $200 or $500 for somebody else. But there are other ways folks could help. Put up a lawn sign, bumper sticker, host a coffee, march in parades, tell others. A little participation goes a long way. And let me assure you, your state legislators know who's been helping them get elected. It doesn't mean they're going to do what you want when you call them up with an issue, but it does mean they're going to pay attention to you. And other than a few core issues, most of us are pretty flexible. So, things like death penalty, abortion, maybe some voting rights, you pretty much got to like stake your position and stay with it. And if you're in line with your district, they'll be supportive. I was going door to door my first campaign, and a lot of people were campaigning. It was a very competitive race because there's some open seat there. And I knocked on a guy's door, and he could see I was festooned with buttons and had a bag. And before I could open my mouth, he pointed his finger at me and said, "Pro-choice or pro-life?" And I said, "I'm pro-choice." He said, "Well, I'm pro-life, but you're the first guy to give me a straight answer. All these people knock on my door, they're all, talking stuff." I said, "Look, I'll respect your opinion, how you came there. You'll respect mine, but maybe there's some things we can find common ground on, like say, make adoption easier, or avoid teen pregnancy, or other issues altogether." And so we had a conversation that was actually respectful. I think he might have actually ended up voting for me. But all the other issues that come up, most of them were pretty open. And I'll tell you some of those stories at the end. So you got to know your state website. In this case, put Maryland General Assembly. In your state, that's where the information is. What bills are up, what meetings are going on. It's not that hard. How to communicate with your state legislators and all the others. And actually, in the state legislature, that's how we keep up with what's going on. My staff and I, when I was in the legislature, we were checking the website just like everybody else. We had some inside information. Read your legislator's bio. Make a personal connection if you can. I mean, people would come and visit me, and they didn't even research that I was a doctor, and they'd start talking to me. I gave them their 15 minutes, and I'd listen for 10, and like, really, you haven't even researched me, and you're on this issue. But sometimes those little connections help out. Oh, you went to Ohio State? I went to Ohio State. You coach soccer? I coach soccer. You sing in the church choir? I sing in the church choir. Whatever it is, find some personal connection. State legislatures are very retail. In Maryland, I had a staff of 1, and I also had some Johns Hopkins graduate students who came over. Some states, they have 2 or 3 legislators share a staff. Sometimes they have 2 or 3. We don't have huge staff. So I'm, when the phone rings and no one's there, I'm answering it. Your communication should be frequent, but short notes, and use data and illustrative history. And I'll tell you a story later about how I learned that lesson. And your legislative sessions most start in the winter months in January, like in Maryland. And so if you wait till the session starts to start communicating, you're already too late. The cycle for us was January to April was session. After session, we're taking a break, exhausted, return to civilian life. In the fall, you start thinking again about the next session. That's when to reach out to folks. Timing is everything, and most states operate that way, so that will be useful. So when I first got in office, internet, computers did not exist. I would get personal handwritten letters, and there was something really genuine about that. And so everybody that wrote me, I wrote back personally. Then, fax machines came, and that was a step forward, and all these faxes started arriving. My staff would tear off the fax, say, "Ooh, a fax, we got to stop what we're doing." And then email, we all know email blasts, where that's at, because we're all besieged by them. They're useful. But the personal handwritten letter, from all my 24 years in office, anybody that hand wrote me, I hand wrote back. There was something more genuine about that. You may come to a legislature for an issue. We're diverse people just like you. And when somebody does something you like, let them know. We all like praise. there's no point in being rude or nasty. I mean, when you go into politics, people are going to say real nasty things about you. You put a target on, and you smile through it. Doesn't mean you like it, and it doesn't mean you forget who was throwing that nasty stuff at you. You just try not to respond. You got to have some thick skin. But I also appreciate people who say, gee, Delegate Morhaim, thank you for doing this bill on agriculture. By the way, I'm here to talk to you today about nursing staff ratios. You got to build coalitions. It's pretty hard to be influential as one, but it's not hard to work with others. And you got to compromise. Other than those core issues, practically everything else, there's a compromise. And stuff takes time. I had bills that took years to mature. And even after I left the legislature, there were bills that I worked on that I couldn't get passed when I was there that continued on and eventually did pass. So I want to share some stories here, because I think that tells you a little bit. So the very first bill I got passed was in 1996. It was actually an agriculture bill. We didn't have in Maryland at that time a wine industry. And I look south to Virginia, north to Pennsylvania, they had big wine industries. I was getting into organic food back then. And we didn't have very many farmers markets. They were basically little roadside stands that a farmer would put out. So I put in this bill to expand those three things. And to get it through, I had to get it through this seasoned legislator who just thought I was some crazy weirdo with these bills. I was from California, so he always thought me some California hippie type. And I sent him all this data about why these were good things to do economically and so forth, and organic food, and the fact that there were pesticides in breast milk and all this stuff, and none of it moved him. So the day the bill hearing came, and it's my first bill. I'm up there sweating, and it's kind of, you present your bill, you tell what your bill is, and then the committee, which is about 20, 23 people, gets asked questions. So he's asking me questions, and he's a really good speaker, and I'm just nervous and I'm sweating. And then he says, so Delegate Morhaim, you mean these little chemicals actually do something to people? And I saw my opening. I said, yes, it does, Delegate. I'll tell you what, I'll just bring a few milligrams from the hospital to the committee tomorrow. I'll give it to you, and we'll see whether it has an impact on you or not. Now, what I wanted to give him was Versed, which is a short-acting knockout drug that we use to do shoulder dislocation reductions and things like that. And I really wanted to give it to him. But it turned out that's what flipped him. He said, oh, yeah, I get it. And he flipped. At that point, all the data in the world did not convince him of anything. From his point of view, as I discovered later, you have your experts or other experts. These are all statistics. People lie with statistics. But when it became personal to him, that's what flipped them. There were other legislators, as I learned. If you gave them just a personal story, they'd say, yeah, that's great. We're not going to, you got a sob story there. We're not going to pass a bill on a sob story. Show me some data. So when you're communicating with legislators, you might want to combine that. So your imaginary letter to your legislator starts off with, I vote. I vote in primary elections. If you're the same party, mention that. And I talked to a bunch of people. Here's this issue. Issue is seniors staying at home and avoiding going to nursing homes. And you say in your district or your area or experience as a nurse, you give some numbers, and then you throw a personal tale in there. And then there's Mrs. Johnson, who's my neighbor. I've lived next door. She's now living alone. Her husband has passed. If she just had a little bit of help at home, she'd be able to stay there longer and avoid going to an institution. So, that's how it's framed. And by the way, I really appreciate what you're doing on something else, and please stay in touch. It may take, time to get all these points through. Let me tell you the blood donation story. So I'm working a busy ER shift, and the hospital chaplain comes up to me, and he's tugging on my shirt sleeve, and he says, my son has an idea for a bill. He wants to talk to you. I looked at him and said, Mitchell, I can't handle this right now. I've got patients everywhere. But okay, he's my chaplain's a nice guy. I'll talk to his kid. I knew they didn't even live in my district. Now, it turned out that this was after 9/11, and his son was 17 years old, and he went to donate blood, and he was turned down because in Maryland at that time, the blood donation age was 18. Here I am working in a big trauma center, and I, always ask people for blood donations in certain circumstances, especially when they had a loved one who were going to arrange a transfusion. It wouldn't be their blood, but you get the idea. And he had researched and said other states it's 17, 16, and even 15 in a couple of states. He said, and by the way, when I got my driver's license, I could check organ donation. I could donate, my liver and kidney, but I can't give a unit of blood. I thought, wow, kid's right. Let's call up the Maryland Red Cross. Why is the age 18 in Maryland? We don't know. It's always been 18. I did some research. It's always, nobody'd ever asked the question. I'm so glad I listened to this kid. Put in a bill and we lowered the age of blood donation, and a bunch of students got involved. Back then also AIDS was a little more rampant, and it was good to get a cleaner blood supply. And they had to start having blood drives for seniors in high schools and junior colleges where there's kids 17 years old. So, he could have said, God, this guy's a doctor. He's an ER doctor. He's a legislator. Who am I to communicate with him? I'm glad he did. And I'm glad I listened. And it taught me the lesson of I should listen to people. They may say something I don't know, even in my own field. Addiction treatment. I started putting in addiction treatment bills in 1998, long before the big opioid crisis hit. And by the way, there's a whole other talk I do on the opioid crisis and the policy decisions. Now, why did I do that? Because I saw it. Fortunately, I don't have an addiction problem. Nobody in my family does. But I could see it happen in the patients that were coming in, and I would talk to them. I'd be sewing a laceration, and how did this happen? Or draining an abscess. Tell me about how you got started. How much do drugs cost? Where do you get the money? And they would tell me $50 to $200 a day. The hardcore people, or I use it heavily on weekends, and and I started thinking about this. Gosh, so many of the patients I'm seeing, tobacco, alcohol, and then the hardcore drugs. So I start getting into this issue very early on, and have been active with it ever since, and put in a lot of first state legislator in the United States to put in decriminalization of possession of small amount of drugs. Not let you off the hook, but don't get a criminal record, because so many people I took care of said, "Gee, I got a criminal conviction, and then my life was ruined after that. I couldn't get a job, employment, housing, and so on." Medical cannabis, organ donation. I revamped the organ donation laws in Maryland. National Healthcare Decisions Day has to do with advanced care planning. That's an issue that I got into because so many times I was doing codes on people, and maybe you've seen this in your own practice. Say, why am I doing this? I'm torturing this person. I'm not helping them, but you got to run the code. So I got interested in advanced directives. Did some research on it, peer review published research. Anybody interested, I'll send it to you. And Leah knows about this stuff too. And only about 40% of Americans had completed advanced directives, half that in the minority population. So I was the first to formally identify in the American Journal of Public Health as a minority health disparity. And advanced directives have been around since 1991. Most of us don't complete them. So I got on this crusade, written books and many articles. Everybody over the age of 18 should complete an advanced directive. It wasn't easy going out campaigning. Delegate Morhaim, what are you doing? What are you working on? Work on this issue, that issue. I also want to talk to you about your death, the death of everybody you know, your loved ones. And don't forget to vote for me in the next election. That's not an easy conversation to have. But people come up and say, thank you for bringing it up. So I'm a big promoter of advanced directives, early palliative care, early hospice care. So that last one, gill nets. So I've told, politicians, we tend to tell you stories of things that work. Here's one where I want to share my own woeful ignorance on a subject, but it was a real lesson for me. So way back in 1996 or so, 1995, 1996, there were all these bills on gill nets. And I don't know what a gill net is. Maybe some of you do, but I didn't know what that was. It turns out that has to do with fishing in the Chesapeake Bay, which is a big bay. I'm not from Maryland, but I knew we had a big bay. I'd seen it. And the two groups that disagree on this were the watermen and the sport fishermen. Now, the watermen work very hard. They're out there, their boats, unforgiving. They're early in the morning. It's very, hard work. They have catch and bycatch and all this stuff. The issue has to do with the kind of netting that they catch fish with. And the watermen want, basically, simplify this, nets with small holes so they can catch more fish, bring more pounds, tons of fish to the dock. That's how I make their money. This is how they've been living and feeding their families for generations. There's nothing more important to them than this particular bill. As passionate as we are about healthcare, that's how passionate they are, plus. And on the other side are the sport fishermen and all the related industries, tourism, restaurants. They want nets with big holes so the fish can swim through and get bigger, because nobody's going to hire their services and support the tourism industry if they're just catching little tiny fish. I mean, people want to catch big fish. Now, these two groups, the hearing was not in the regular hearing room. We got a schedule of bills, and it wasn't. And I saw 5 bills on gillnets. What is a gillnet? I don't know. And I go to the hearing room. It's filled with men, angry men, and a bunch of them come up to me and they say, and by the way, usually we always had one state trooper in every hearing room because people can get excited about various issues. Here, there's like 5 or 10 state troopers. And these two groups are there. And as I'm walking up, they come up to a bunch of them, care around me and say, "How you voting on gillnets?" Now, I don't know what a gillnet is, so I mumbled something and scurried up to my seat so I could avoid being confronted again. But this is an issue that's been going on in Maryland and Virginia person, for like 100 years. And for these people, this is the most important issue they face. And they are thinking, this bozo who doesn't know anything about it has 1 of 21 votes on the most important issue we're facing. So I listened to the hearing, and a couple of people came up to me and said, would you like to learn more about gill nets? And I said, that'd be nice. And so I learned all about gill nets, and it was fascinating. One of the best things about this job was learning about stuff I wouldn't know otherwise. And nets, catch, bycatch, weave, color, seasons, migrations of fish and crab and all this stuff. It was great. I got taken fishing a couple times. Once I remember well. Pole was put in my hand. The guy put some bait on a hook. Fish came out. He took the fish off the hook. Later cleaned it while we had a nice lunch. I came home to my wife, looked like this fish, like I was some kind of caveman, had done some serious work, but actually I never touched a fish till it was in a plastic wrap. But I ended up, by the way, with the sport fishermen. My district doesn't have any watermen in it, but 3 people, including the chief of cardiology at my hospital, were sport fishermen, and I always felt the bay was kind of over fished. But what I'm so I supported the sport fishermen to give the fish a break. But the point of this story is we're very passionate about stuff. Other people are passionate about other issues, but it doesn't mean they're going to immediately understand what we're talking about. So what I described there was not something I learned in an hour or two. It was over a period of a couple of years to really grasp the full import of it. So, when you talk to folks, where are they at? It takes time to absorb a lot of this stuff, not for lack of interest or not for stupidity, but because it just takes time. And so when you're talking about healthcare stuff, I mean, there were doctors or nurses who came down and started saying, we have a patient with an acute MI, and we're going to start, some tental or this or that, and then we're going to into the ICU, and then we have to do a CABG. What are you talking about? And everybody has opinion out of healthcare, usually based on their own personal or family experience. But we can be better, and nurses have great credibility. You all are highly respected, more than doctors, and you have that more caring approach. So, you got to spoon feed your legislators if they don't already know the subject. So I'll stop there and throw it open to you for questions and comments and personal attacks. These are my other issues that I talk on, and I hope that you will get involved. Let me just say too, back to that original communication. If I got 3 genuine letters from constituents on an issue, that was a grassroots firestorm of public opinion that I would pay attention to. So you just have to communicate well over time, and you'll be really influential, whether it's healthcare or arts or your kid's school or stop sign on the street, whatever it is.
Before we go to that, why don't you tell us about your book? Go ahead and give us a few minutes on your new book coming out.
Thank you. It's out called Preparing for a Better End. It's the second and newer version of a book I wrote about end-of-life care and the promotion of advanced directives. It's got great reviews and great endorsements. Preparing for a Better End, www.thebetterend.com. Please buy a copy. It's online. I understand that Hopkins is going to be doing a audio version soon, and endorsed by famous people, including Maya Angelou, U.S. Senator Ben Cardin from Maryland, Leon McDougall, who is a physician at Ohio State, head of diversity, equity, and inclusion there, and a bunch of other people ranging from Buddhist spiritual guide to a evangelical Christian minister, and business people, because this is universal. And I hope everybody here has completed their own advanced directive, and if not, you should get everybody to do it. When my kids turned 18, my wife and I gave them advance directives. Say, you got to complete these. They were 18. Yeah, well, I've seen stuff in the ER where 20-year-olds, 18-year-olds, we have tough decisions to make, and we need to know who to go to. We don't. It also, by the way, would relate to Medicare fixing the cost fix. Medicare is 900 billion. 300 billion is in end of life care. I'm on Medicare. I'm old enough. Still in good shape. I ran 4 miles yesterday. I'm in good shape. But if 100% of Medicare patients complete advance directives, and because most people don't choose, I want everything all the way, although that's a choice, which we respect, you could probably save 30, 40% of that 300 billion that's spent on the last 6 months of life. And hospice and palliative care, great services, in all these situations, but length of stay, hospice care is what you're allowed 6 months, but average length of stay is 2 weeks. And in my career, maybe yours, earlier on, it's changed a bit now. Say, oh, somebody's dying, they pound on the patient for extensive periods of time, and then say, oh, let's call those palliative care, those weirdo palliative care people, like throwing in the towel at the end. We should access all these services early. And so I've been on the crusade to get people to complete advanced directives from adulthood on. And you change it. The best one, by the way, I've researched them all, mydirectives.com. It's free, it's national. You can print out a QR code. I carry it with me when I'm jogging. I carry it with me in my wallet when we're traveling. My medical records are not always where I am, even in Maryland, when I'm in Maryland. mydirectives.com. And your institution, it's free to consume to individual people. If your institution's interested, that's how they charge a fee to organize that. So, but the book's Preparing for a Better End. Get a copy, share it.